My name is Sandra García Armesto, and I'm the Executive Director of the Aragon Health Science Institute, EACS for short, if you want. Well, together with our colleagues from the Barcelona Supercomputing Center, and you will hear in a minute from my co-host, Alfonso Valencia, we are coordinating the CSA HealthyCloud. The objective of this initiative is mainly providing a ready-to-implement roadmap to the health research and innovation ecosystem. Definitely should be a cornerstone of the European research and innovation landscape. Along the last 2 decades, the Aragon Health Institute has been lucky enough to build extensive expertise and resources for the utilization of real-world health data. We have been using it for research, for innovation, and for policymaking support. I must say that we have been proud contributors to the major European initiatives that actually have paved the long way to the current exciting developments that we have now in motion in Europe to create the European health data space for secondary use of data. To mention just, to give you a flavor, we can start as far away or far behind as the 7th Framework Program with the European Collaboration of Healthcare Optimization, the ECHO project. Then it came the Bridge project, the Strategic Bridge project, which was actually follow-up for the joint action for health information for research and policy making. This joint action actually just finished, has already had an offspring, if you want, which is PHIRI, the Population Health Information Research Infrastructure, that again has had a new incarnation as the PHIRI COVID project. I think we are all really well aware of how these devastating epidemics that we have been suffering. The COVID has also been good fuel for the engine of moving forward the data sharing, utilization, and for research and policy making in our landscape in Europe. Let me say that the common denominator of all these initiatives I just mentioned is actually the focus in using real-world data for innovation, for research, and for policy making, for supporting policy making, evidence-based policy making. The Health Research Innovation Cloud is definitely one of these elements in the ecosystem that we need to build. And we are intending this to actually initiate together this discussion together with you, all major players in the field, to help us see how we can better shape it and fit it.
My name is Alfonso Valencia. I'm the director of the Life Science Department of the Barcelona Supercomputing Center. As you can imagine with this name, we are a big technology center. We are hosting one of the largest European supercomputers, Mare Nostrum, that is part of the European network of high-performance computing facilities. As a research center, we are pretty large. We are crossing the 700 scientists and engineers by now. And on the biological side, we coordinate the Spanish Bioinformatics Institute, that is part of the European Infrastructure for Bioinformatics, ELIXIR. We are very much involved, and a good part of this is in collaboration with Sandra and her team, in the starting of the Spanish personalized medicine project called IMPACT, dealing with the data part of the project. So more and more of the resources of the Barcelona Supercomputing Center are moving into this direction of biology. Coming from a background in data science and computation, we see this as an opportunity for new developments and introduction of technology very much associated to the development of genomic medicine, how to integrate the different type of data from genomes, images, other medical data into the research and to the clinical practice.
Good morning, everyone. Well, I guess that setting the scene, we have been setting the scene during the conversation, but it is clear that we are producing lots of health data those days. We know that. We are producing lots of data, but this data is, let's say, compartmentalized. Their data is produced from different places, from different typologies, and and sometimes it's fragmented per country, per domain, and sometimes it's hard to link and to exploit at the maximum. So we know that linking all this health data and health data related data together would be a huge opportunity for research purposes, policy making purposes, and also and ultimately in its translation for the caregiving purposes. So the point is that how can we face this challenge? So our idea here is using distributed computing. So we have been talking about distributed computing at the beginning of the session. So what is distributed computing here is a way to approach the computation where the data is, instead of doing the opposite. Instead of generating these huge repositories, mixing all data together, the idea is placing the computation where the data is, and also maximizing the use of the computational capabilities that are on private premises, okay, different research centers, or that are available in public services, for example, in supercomputing centers. So this is why our project, our CSA, is called HealthyCloud, using health data with cloud computing. We are designing the Health Research and Innovation Cloud. And remember that in Spanish, the Y means and. So we are not assessing the health of the cloud. We are generating a Health Research and Innovation Cloud. Next slide, please. So, but what will be the actual outcome of this coordination and support action? The actual outcome will be the strategic agenda for this Health Research and Innovation Cloud. And what will be included in this agenda? We will talk about different topics. For example, we will talk about the ethical, legal, and societal impact, from the GDPR elements to the code of conduct with health data research or data altruism for citizens. Also, the ethical committee's role here. We will talk about the data itself, okay, the types of the data, common data models, fairness of the data, linkage opportunities. We will also talk about the data governance, how the data is curated in the data hubs, or how are the different access policies we will researchers or policymakers should take into account when they want to use these different health or health-related data. We will talk about the future metaphors to interact with this Health Research and Innovation Cloud, for example, through a FAIR data portal or a collection of FAIR data portals. And clearly, we will talk about the options for the computational solutions that will support the rest of the elements, that these computational solutions will be part of the implementation roadmap that will be the core of the strategic agenda. All the project will be driven by 2 use cases: atrial fibrillation and cancer risk factors. Okay, and last but not least, this CSA has a consortium with 21 partners. It's a nice consortium. There are major European research infrastructure related to health. There are public health institutes. There are research centers, supercomputing centers, health services, universities. But we couldn't do that by ourselves. We need the engagement of much more actors: developers, implementers, adopters, future users. So this is why we are going to set up a stakeholder forum that will grow during the project development in terms of the number of stakeholders, in terms of interaction with these stakeholders. And this is why we are here today, to make the HealthyCloud project a fruitful project with all of you.
So I'd like to say a few words about EOSC-Life, which is one of the many projects under the EOSC umbrella. And I appreciate that the European Open Science Cloud and EOSC can be quite confusing. I tend to think about it this way. Look at EOSC as 3 major components. So one is really the consolidation and the provision of e-infrastructure. So that's work that's been done with the European e-infrastructures to bring them together into a federated core. There is also a very large policy component within European Open Science Cloud to drive the transition to open science. And then there are a set of projects, and EOSC-Life is one of them, where scientific communities and research infrastructures essentially come together to make sure that these organizations, and most importantly, their users, can benefit from the development in the European Open Science, but also that they get the support needed in this transition to more of an open science practice in the European research projects. So next slide, please. So if we look at EOSC-Life, then this is the life science community and the life science research infrastructures on the S3 roadmap coming together in one project. There's 13 of us, so it's quite a large project. It's about 24 million, and we're halfway, so we will be done somewhere around 2023. And so what we've set out to do in EOSC-Life is really to establish the life science component of the European Open Science Cloud, and we do that by publishing a lot of fair life science data resources within the EOSC and make sure that people can access them and find them. And of course, many of the data resources in the life science pertain to people, so we need to make sure that we honor the trust that's usually research volunteers have given. And so we need to develop policies, guidelines, and processes to make sure that we have sort of everything in place for secure and ethical data reuse in research projects. And if you have data and you can use it, then of course you also need tools. You need something to do with the data. And so there is a large part of the project is to help to develop this ecosystem of innovative life science tools. That means working with the research infrastructures, with the users, but also with the tool developers to help them to sort of package and deploy and make use of the new cloud opportunities. And we try to do this in partnership with the community. And so we are running open calls to enable sort of researchers and projects to engage with us. And we've just closed our big open call where we had over 100 projects applying to partner with EOSC-Life to explore the opportunities in sort of the European Open Science Cloud. So next slide, please. So, so more specifically, so I mean, life science is rich and diverse, and today we talk about health data, the ambition of EOSC-Life. We span all of life science, so our ambition is actually to interface with and support research across the board of the European research projects. And the research infrastructures in the project are really the advanced facilities that provide support to European researchers. So these are the experimental facilities that sort of give single molecule resolution and of molecular interactions, but there are also research infrastructures like ECRIN that are supporting multi-year clinical trials. And so it's a very broad set of data, and there's a very broad set of users that we are trying to bring together. And really what we're trying to do is to find a platform of common solutions so that life scientists can make use of all of this data, all the tools and all the workflows within national clouds and within the sort of collective European cloud. And I think that's the touching point with HealthyCloud, is really to make sure that the procedures and the implementation that of tools that we're making in EOSC-Life also fit into the future sort of strategic research landscape for health data. So next slide, please. And so just a quick example of the work that we've done. So I think COVID has been devastating, but it's also been an opportunity, I think, for us to show how this unified platform can help in the response. So just a few examples that's happened in the project. We have supported international biohackathons and community efforts with cloud resources. So there was many of the national platforms that stepped up and provided these early next year. We front-loaded some developments with over a year to make sure that we could help the community to deposit digital assets, in this case tools and workflows, in an open way for reproducible science. We are building, and so this is work led by ECRIN, a repository to host the clinical trial data coming out of the many ongoing clinical trials. So that's a secure data repository for deposition of these data types. And we're also, EOSC-Life is one of the projects that are helping to support the COVID-19 data portal and extend that with integration of multiple data types.
I will be talking to you today about the population health information research infrastructure and our activities focus on the perspective of COVID-19. And I myself I'm head of unit at Cienzano, and we're collaborating in various different initiatives that work in the same direction, which include HealthyCloud, TEHDAS, and many more. Next slide, please. So the Population Health Information Research Infrastructure is a European mechanism. So what we really try to do is to facilitate and support data-driven population health research and exchange of best practices to support decision-making. And this specifically in the area of population health. So covering not only the sick population, so patients, but also the general population and healthy people. Next slide, please. So I will just focus on three main areas because we were asked to be really short. So the three main areas of our activities focus around catalogs, expertise, policy, training, and interoperability, which are all key for any research infrastructure operating across Europe. What we're doing is we're providing a health information portal where you can find fair catalogs on health and healthcare data and to link data sources in a GDPR compliant federated way. So what we're doing at the moment in the next slide is you can find a screenshot of our health information portal, which provides catalogs of population health data sources that are available in countries. So the really core idea here is that a researcher across Europe does not need to go to each and individual data source or population health data source available in each country to search which one is accessible. But through this population health information portal, you can find an overview of all the main data routinely collected population health data sources available in countries. We're also building population health studies and catalogs of international guidelines or initiatives with relation to COVID-19. And we also provide training material and courses that are available for COVID-19. And we also are sharing catalogs on ethical and legal aspects. What is also very similar to some of the other research infrastructures is that we're building this federated access to data where the dashboards will then be visualized onto this European Health Information Portal. So being able to do research with data sets that are scattered across Europe in a federated way. Next slide. The second objective I wanted to focus on in the next slide is to provide a structured exchange between countries on COVID-19 best practices and expertise. Could you go to the next slide, please? And here we are providing various ways in which we can exchange expertise that we have built up across Europe, especially with COVID-19. We saw that international organizations weren't always providing the answers that our partners were looking for. So we mostly work together with public health institutes, research institutes, ministries of health, or infectious disease centers. And so in the next slide, the way we exchanged expertise is to work through a rapid exchange forum, which is a meeting we're organizing every 3 weeks where a researcher, but also policymakers can put forward the questions that they have if they need a really rapid response to how something is dealt with in a specific country. And what is interesting here is that we're not only looking at the direct effects of COVID-19, but we're also looking at the indirect effects of COVID-19, which is sometimes still lacking across Europe. But some other expertise we're exchanging is we're also looking at research methodologies that are being used to assess this wider effects of COVID-19. We're also exchanging expertise in countries on how we can allow this federated access to data through 4 research use cases. And we also work on foresight modeling and scenario building. And so in the next slide, you can see this, the final objective I wanted to put forward. It's really working to promote interoperability and to tackle health information inequalities by providing training. And so in the last slide, you can see that the trainings we focus on are all encompassed in a European School on Health Information, where we share fundamental health information tools and methods used by public health professionals across Europe. And we've already provided different training courses. Currently, the one that's ongoing is on foresight methodology. So we're building the knowledge in countries on how to carry out a foresight analysis, but we're also supporting different trainings in a developers group for data management, for federated access to data, on epidemic management, and on standardized health information tools, amongst others.
I'm going to run through the Beyond 1 Million Genome Project and some of the steps towards implementation of a trust framework for federated genomic data access. If you go to the next slide, we can't really start this story without going back to 2018, when there was a declaration of cooperation signed by European countries to enable cross-border access, or move towards cross-border access to 1 million genomic data sets by 2022. And this has now been signed by 24 countries, and 4 observer countries are also participating. We go to the next slide to show where the Beyond 1 Million Genome fits in. This is a CSA project, and being a CSA, it aims to create the legal guidance, the best practices and the recommendations to create the infrastructure to enable the commitment of the 24 countries towards the 1 Million Genome Initiative roadmap. So we go to the next slide, you can see that alignment between the roadmap and the activities of the project. So on the left-hand side shows the 1+ million genome roadmap, and then on the right-hand side, the objectives of the Beyond 1 Million Genome Project. So the project is looking to define the requirements for accessing genomics and personalized medicine data by engaging with all of the different levels of key stakeholders that are absolutely critical to define those requirements. They're then taking those requirements and translating them for the data, the standards, the technical infrastructure, and the ELSI components into the technical specifications and implementation guidelines that then captures the European best practice. And then, of course, to look forward towards the long-term operations and to drive adoption, we are developing a maturity level model, and I'll talk about that a little bit more later, and also a methodology for looking at the economic evaluation of access to genomic data across borders. You go to the next slide, shows in bright pink the work packages for the Beyond 1 Million Genome Project. And we've been running nearly for a year now, so I'll just quickly flash through a few of the highlights of some of those activities. So we cover stakeholder engagement, as I've already mentioned, and we've developed a portal that will be used to distribute early versions of the deliverables to the stakeholder forum members for feedback. We have an ELSI toolkit, which is in development, and today it's focused on mainly analysing the 1+ million genome initiative use case needs and evaluating technical infrastructure components from a regulatory and an ELSI perspective. We have the standards and quality guidelines here. So this is the minimum requirements and for provenance of samples and whole genome sequences, and some of the quality guidelines and initial guidance of along these lines will be pushed into the portal for feedback in the next few weeks. And then we have the development of the federated secure cross-border technical infrastructure. And here we've had a lot of activities. So we've got a scoping paper that's now been endorsed by the 1+ million genome special group, and also a proof of concept that's underway using rare disease as a use case that has started making use of identified standards and reference implementations. We also have a work package that's focused on the personalised medicine delivery, the scientific and societal impact. And here I mentioned the maturity model before. So this is a model that essentially looks at all the different domains and allows the country to assess their maturity in accessing genomics data and implementing into personalised medicine and healthcare. And we will be shortly surveying this through a panel of experts to take this model to the next level of endorsement. We've also run one of 3 capacity building knowledge exchange country visits. So we're having meetings with 3 of the most established countries, so UK, Estonia and Finland, and we've already completed the UK visit, and we have the other 2 visits upcoming shortly. And then as sustainability and national coordination, this involves focusing on the national guidance and support. We are also focused on the 4 use cases and the disease areas, and that are part of the 1+ million genome activities, and also a working group that involves looking at the models for industry involvement. So combined, looking across all of the activities, we are, and obviously ensuring that we have the citizens' trust, will result in having a 1+ million genome trust framework and also then advancements in the field of personalised medicine data across Europe. So if you go to the next slide, I've highlighted some of the challenges that we're facing, and I think these overlap with many of the projects that we are talking about today. So just to point through some of these, so the stakeholder engagement is absolutely critical. If we do not bring along the stakeholders and get this part right, then the rest essentially is going to fall straight over. So this involves a lot of work, especially with citizens around education and communication, and we need to consider how to do this across multiple projects. We don't specifically have funding for the citizen engagement beyond the stakeholder activities. So here we've set up a task group, and it would be great to think across all of the different projects that are engaging with citizens in this space. Secondly, I wanted to point to the maturity. So obviously each of the member states are at a very different stage of maturity and readiness, and we're supporting all of the different stages and the different maturity levels of the 24 member states, and specifically through the knowledge exchange through the virtual country visits, and also with the initial proof of concept where we're using synthetic data. And this proof of concept is being run by the most established member states that have to some extent infrastructure that's ready. So bearing in mind that this is a CSA, we need to think about how we are adopting, which takes us to the third challenge, which is the adoption challenge. How are we actually going to get the recommendations and guidelines for the trust framework adopted? So currently we are looking at partnerships with the active projects, and some of which I've shown in the slide at the bottom, and the use cases as well. So we've also got the proof of concept I've mentioned, which is within rare disease, to look at the use of identified standards and reference implementations. It's critical for us to think about, on a national level, the setup of national mirror groups, which I haven't had a chance to describe, but essentially reflect the 1+1,000,000 genome working groups, and also an effort to generate more sequence data to get us to the target of the roadmap of sharing 1 million genomes by 2022. We've also got to think about the future funding and sustainability. So we are actively involved now in the European health data space, in the pilot, and also looking at future calls from Digital Europe. And national funding is also absolutely critical here. So the member states need to sign up to essentially develop infrastructure within their national setting and think about the long-term sustainability.
I'm from the TEHDAS coordination team from Citra. We'll be presenting what's going on in this joint action. So next one. So towards the European Health Data Space Joint Action is this a project that creates concept for the secondary use of health data in Europe. It does not create concepts for the primary use of health data. And it is a preparatory body, not this legislative or executive body. And it really does not define the European health data space, but creates these proposals, options, and solutions for exchanging health data between different European countries and for the benefit of citizens' health, public health, research, and innovation. The joint action is a project between 25 European countries, from which 21 are EU member states and 4 non-EU member states. It is co-funded by the European Union Health Programme with 2.5 million euros, and the rest 1.6 comes from the member states. It does not build working IT solutions, nor pilot use cases, and it is not part of the Horizon Europe funding program. However, it has a clear scope with defined deliverables and timelines. So we started on the 1st of February this year, and it will last for the +2 years more. Next slide, please. The work is really divided into 8 work packages, which sums up quite nicely what the project aims for. The first three ones are related to the project management. So the first coordinates the project, and the second one is communicating the results and deliverables, and the third evaluates the results. So it's really about this project management. The fourth work package really engages in dialogue with different stakeholders to identify their needs and expectations for the European health data space. And it also builds on top of what has already been developed in different project initiatives like we talked today as well. The fifth work package develops options for governance models for the exchange of health data between the European countries. And the sixth work package develops guidance on ensuring the data quality and interoperability. The seventh focuses on the technical interoperability fully. And the last, the citizen work package, seeks to really gain the better understanding of the citizens' attitudes toward sharing their health data. And it also identifies ways to inform people and raise awareness of the benefits of regular use of health data.
I will just ask a few questions, and this question will be the same for the 5 projects that were presented during the first session. The idea is to try to understand what are the characteristics of each of the projects in order to understand how to optimize the use of the outcome of this project to avoid overlap and to define what are the best ways for synergies and cooperation. And I think to characterize all these projects, we can ask 4 different questions. The first one is, what is the data source you promote in your project? Are they health data, meaning data from population health, from prescription database, or real world data from the hospital or from the primary care? Or are they research data from observational study, from registries, or from interventional studies? So the first question is related to the data. Second question is related to the nature of the data. Some projects obviously focus on one specific type of data, on genomic data. Other cover also other omics or imaging data, environmental, lifestyle data, and clinical data. So second question, what is the nature of the data you deal with? Third question is, what is the objective for the reuse of data? Is it the public health? Is it the healthcare? Is it the access to high performance computing? Is it the open science, the transparency, or is it just to transfer the data from the health system to the research system? And my fourth question is, what is the role of national or regional hub in your project?
The idea of the HealthyCloud is try to be as broader as possible. So we didn't want to concentrate in a single type of data or in a single source or single nature. So the idea is to extend as much as possible the scope of the data we want to use. We want to link, we want to mix to maximize this proper linkage. So I guess that as the HealthyCloud could be seen as a corner project. So the idea is being able to mix and link as much types of data, source of data together. The same happens for the third question. So the objectives of the data, we want to serve a broader community. So we want to serve the research community. I guess probably is the main community we want to serve, but I guess we could never forget that the policymaking community is also very important, and because at the very end, the final use of this health data should be improve the caregiving, okay, improve the health of people. So we will need to start doing research. We will need to translate this research or analyze the research with policy decisions, and we need to do this translation to the caregiving activities, to the general practice. And in terms of the data hubs, that's a good question, because this is something that we have seen that always we always shock or collide, because the definition of the data hub is something, again, it's something blurred. Sometimes, for example, in France, we have this French data hub, which represents the whole health system. But for example, here in Spain, or maybe in Germany, where we have this federal organizations, we couldn't have this centralized point. So we will need to define the architecture of the data hubs in terms not only the representativity, for example, member states or regions, but also the type of the data. We have these nice repositories, for example, the EGA, which are right now holding lots of genomics data. But that could be fragmented or distributed. I know that they are working on the federated version of the repository. So the specificities of the data hubs should be defined. It should be something that should be taken during the definition of the strategic agenda.
So EOSC-Life, we are firmly rooted in the research part of data. So it's sometimes personal data from volunteers participating in research, biomolecular data from human volunteers, but it's always coming out of a research context. And the data types we're working on are very broad. So we have 13 research infrastructures in the consortium. And so this is detailed biomolecular data, could be structures of individual proteins or viral particles, imaging data, all the way up to translational omics data, and indeed ECRIN is part of this clinical trial data. We also have some more biological focused infrastructure, so there is also data on ecosystems, for instance, or large scale plant facilities. So the objective, I would say we have twofold objective. So it's always centered on the researchers. And so we are infrastructures, and our users are, of course, scientists that make use of these facilities. So the first objective, I think, is really to help the primary users, the people who come to these facilities and partner with them for projects, to help them fulfill their data management mandates, but actually more importantly, to help them to make most use of their data so they can integrate it in context of multiple facilities and so on. I think the second objective that we're working on is to open up that data for the research community at large. And so we are opening up and exposing the data resources from the various research infrastructures. There can be protein structures from Instruct, it can be genomics data, or indeed a clinical trial data repository that we're doing for COVID. And so that is about enabling the community at large to make use of these open data assets. And so the role of the national or the regional hubs, so we work through the research infrastructures on the S3 roadmap. And so each of these infrastructures, of course, have taken on sort of a coordinating function for their community, but they actually are based on national facilities. So the experimental facilities or the sort of expert centers, they of course sit at national institutes or research centers or universities, or indeed sometimes they are national networks. And so I think we are in a way federated by default because we are bringing together all of these facilities.
So indeed, we cover more the population health data area. In that sense, the initial perspective is not based on a specific research study, although when you think about data that's collected by a National Public Health Institute, sometimes they collect something for monitoring and research purposes. So in that sense, I think what Juan is saying is that these barriers are sometimes not really clear, and the different areas can move into one to the other. And so when you think about the nature of the data, for us, the data can be quite diverse about different types of registry, administrative data, monitoring data on mortality or pharmaceutical use, any type of data that is routinely collected by public health institutes or organizations that monitor the population health. And also we provide catalogs with guidelines, tools, and trainings. So this is not data as such, but giving an overview of different trainings that are available, or tools or guidelines that are useful in that specific area. What is the objective of the reuse of data? So for us, it's really also connecting this public health perspective and the healthcare. So linking these different areas, because for population health, it's really important to look at the status of the health, the determinants of health and healthcare systems. So these different areas really come together and reflect in the health of the population. So in that sense, I think we also support this transfer of data and support the compilation of these different data sources for research purposes, but also potentially for monitoring, which can be used cross-border. So how is another country doing with a similar COVID-19 measure? How does that impact? Can I compare that to my country? So there also, it's not a clear distinction. Is this public health monitoring or is this research? I think it comes very closely with each other.
Yeah, so mine is probably a far more straightforward answer than some of the other projects. So our data source depends on the country, essentially, but will likely to be from national initiatives. So cohorts or research data is also in the possibilities, but really it's likely to have been generated from a clinical or healthcare setting under national programs to generate whole genome sequence data. So likely to be patients with specific diseases. But having said that, also as part of our study, which I didn't really talk about today, there is also a collection of more reference type data, or there may be data from population studies. So ultimately, the most important factor to us is to have the minimum requirements and the quality standards, the minimum quality standards for the whole genome sequence data and the affiliated clinical data. So that will depend on, it's more important perhaps than where the data is coming from. The nature of the data, again, quite simple. It's genomic data, affiliated health data. Objective of the reuse, again, fairly straightforward. A healthcare setting and increased personalised medicine approaches. So that's obviously a big banner for many things, but that is the ultimate reuse aim. And then the regional or national hubs, equally important. We need to think about the different perspective from each of the different countries and what they can offer with regard to their healthcare structure, infrastructure that's within their countries and what needs to be established.
It's a very wide spectrum of data sources. So we talk about health data, of course. So it covers everything. Maybe to widen that scope a bit outside is a little bit, there's a discussion, wide discussion, what is health data? Is it also like environmental data or the shopping data that we use? So that I think it's outscored, but everything that covers the health data is in a wide scope in TEHDAS project. So the only limit is that we talk about the secondary use of data, not the primary use of course. And we do need to consider, this is the joint action, it's the health data space, so it's a bit different than the other data spaces within the European Union. So it's more of national focused because the specific national health regulations that we have in different countries, we do need to consider a bit more how are these different countries developing their health systems, health data. There's countries that are very developed in their registries, for example, the Nordic countries, they have collected registries from the 50s or 60s, and then there are other countries that haven't. So we do need to take into consideration these different types of ways of doing health data and dealing it within the Europe with TEHDAS. And that's what we do.
I think as Europeans, we have a great opportunity. I think there's political will. I think that the COVID definitely has worked as an accelerator. I think some of the speakers was using this word. And we are now in a position to make that happen. We have been working alone 20 years to get it. So let's do it. Alfonso.
I have little to add to what you say. I probably am more impatient than you. I always I want solutions faster and I want solutions now. But I'm happy to see that there are many different ways of approaching the problems of data access, communities, regulations, infrastructures, and that by combining all these different approaches, we may be able to get these answers that we need faster and in a more efficient way. So even if I'm still impatient and I still want to see solutions now, I'm rewarded after the meeting seeing that there are many layers of approaches from the organizational, from the scientific, from the technical point of view that by putting all them together and crossing them, we are building this network of approaches and solutions that probably are going to put us
It's an
better
it's an
place.
ecosystem, Alfonso. You're a
I
biologist
want
by
to say like as
training,
a
and that's
method
the
of
whole
crossing
building.
approaches, no, as an ecosystem of solutions. Needless to say that this is also a very proper European approach, because always we have to take into account the different countries and the different type of mentalities and approaches. So I think that also is good to see after all this time that we also not only being able to build things, but also build things in a very European way, if I can say that.
So thank you very much.